Okay.
So Mr. Kelly, he came in today with a pain in his left arm. It's been going on for how many days?
Oh, a few weeks.
A few weeks actually, in fact. So, and then he wake up from sleep one day, actually had that bulge on the section to the biceps sheath, and that actually area here is the skin, subcutaneous fat, and this is a large area of actually biceps sheath hematoma. So he has a blood collection actually around the biceps tendon. Scroll to the next one. So yeah, that's just more or less of that, and then we actually get the shoulder view more. So that just again expansive hematoma just covering all this area, and then here actually he has this area actually should be filled with the biceps tendon. It has actually a rupture there. He still actually have some range of motion under sterile procedural precautions. This is sterile gel, and over here we're gonna do this in a cross section. So okay, so this is actually where the hematoma is. We're gonna be actually coming from the skin down this way, so we should actually see the needle tip in a way. Good. So good. So actually, as now we actually retrieve the bloody fluid there, I'm gonna give the patient a anesthetic, and then we're just gonna draw this again. That actually help with kind of like faster resolution of the problem when the blood is drained, and prevent actually further organization of the clot, because it can actually form a scar tissue, and also actually can potentially get infected. So that's about 7-8 cc's of bloody fluid. That doesn't need to be analyzed again, that just from the tendon rupture actually causing this issue. Here we're just gonna go, again, I think he might have just a little bit more. Okay, I'll go a little deeper. Yeah, okay. So it tend to kind of form like buckets, or what we call as a medical term, loculation, especially if the blood sits for a little bit, it gets separated in space by forming kind of like a little bit of small buckets that gets isolated. That's why actually on the first one, after we retrieved the first 7 cc's, it stopped. But now as I went actually a little bit deeper, there was like more retrieval of this, about again another 7 cc. So that's that again, just thick bloody fluid coming out. So just a little bit more. Good, okay. So there is not much more here. Here, this is just a solution with the cortisone, and we're gonna actually see it in real time, going into the biceps sheath. So here, good. Needle tip, trying to localize, it's somewhere in there, as actually you see it moving on the screen there. Just get closer shot there. There is a little bit of, actually, as you can see, hematoma fluid left, but it's not nearly as much as it was before. Close, please. Good, and then as you actually see here, you see the crystals. These are the white shadowing from the triamcinolone that just infiltrating the biceps sheath, and then will come out. Here we're just gonna do a quick scan again. The size of the hematoma is considerably smaller. See that? That's actually what is the residual that is left.
Oh, wow.
Yeah, very small amount now. Yeah,
Good.
so that's gonna help him with pain and healing and everything.
Good.
So yeah, pretty much actually most of this resolved now. Good, perfect, sir.